Hi, this is Dr. Tarrin Lupo, and welcome to our video about fibromyalgia. We're going to talk about some common mistakes that doctors often make when diagnosing fibromyalgia, and then I'm going to give you a list of symptoms, and at the end, some natural options for management of this condition. First, let's talk about a little history of fibromyalgia. So back in the 60s, 70s, and 80s, as food got more industrialized, people got sicker and they started going into doctors' offices and complaining about diffuse pain throughout their body. The problem with fibromyalgia was there's not really any test for it, and you can't just take an X-ray or an MRI or even do a blood test that kind of describes what fibromyalgia is. So the doctors, when they ran these tests, told them nothing was wrong with them. In fact, many times they told them it was all in their head. So what happens is these patients come in and start demanding care, and the doctors keep ignoring them because they don't know what to do with them. So over the years, a diagnosis gets created and made up called fibromyalgia. Fibro is a Latin word for muscle fiber. Myalgia is muscle pain. So it's basically a fancy way of saying muscle pain. So a patient would come in, say, I have all this muscle pain. Doctor would package it in a Latin name and give it back to him and say, you have fibromyalgia. And everybody was happy. But the poor patients didn't get any relief. So now the doctors have a name for it, and patients are happy that it's actually recognized. The only problem is the doctors have no clue what's happening or why it's being caused. So these patients come in, and because you have diffuse pain all over your body, it can be all these different kinds of reasons. The doctors make what's called a garbage pail diagnosis. And what that means is when they don't know what to name it, they just call it fibromyalgia and throw it in the garbage. The garbage pail diagnosis covers everything. So as this disease starts to rise, doctors realize they have to come up with a more standard way to diagnose this. So they put together a list of symptoms. To truly have fibromyalgia, you're supposed to have multiple symptoms on this list, not just the pain points that kind of everybody knows. So this is a mistake your doctor could be making. Classically, it was 11 to 18 pain points, but that has changed where it needs to be either 11 pain points on the top of your body or 11 pain points on your bottom, not collectively. Another area where doctors kind of mess up the diagnosis is the pain points themselves. To have true fibromyalgia, you can't just have tender points that hurt. What you actually have to have is radiating pain. So if I push on your back, the pain moves through your body and either goes to your jaw or your neck or your shoulder or down your leg, or it moves somewhere, it radiates. So they have to be 11 points of radiating pain, either on the upper body or the lower body. Another thing that goes hand in hand and is very common with fibromyalgia is chronic fatigue syndrome. Most of these people are extremely tired, and rest does not alleviate it. They're even more tired and sore when they wake up. Some other symptoms include pain that moves around the body as far as it changes from day to day and moves around different places. Also, severe stiffness. If you sit too long, you just can't get up. Another issue is they're highly sensitive to everything, including sounds, light, and especially temperature. Temperature is the big one, where their whole demeanor will change with the wrong temperature. Another common area for pain is in the face, and especially in the TMJ, the temporal mandibular joint. Another big complaint of patients like this that come into my office is they complain that they feel swollen, but they don't actually look swollen. Their joints look okay. They say they have an internal pressure. And what goes hand in hand with that, of course, is GI problems. So in other words, they have a lot of gut issues, especially alternating between constipation and diarrhea. These people also have shifting numbness through the face, the hands, and the feet. Another problem many complain about is insomnia. They just can't sleep, and their quality of sleep's terrible. As this disease progresses, what happens is they actually start having bladder issues too. Real common to have bladder urgency. Lastly, as this goes on long enough, it just starts really causing a lot of problems with mood regulation, hormones, sometimes even your thyroid. So, how do we manage and support this condition naturally? The biggest thing you can do on your own is try to reduce inflammation. Inflammation is by far the worst problem these poor folks have. And what I usually find out is every patient that's walked into my office so far has had a hidden food sensitivity. They're eating something that's making their inflammation much worse and they don't realize it. The big ones are wheat and dairy. So removing those is a great start. But there's one other one that's pretty specific to people with fibromyalgia, and it's fake sugars. Just about every fake sugar should be avoided. These people, especially the fibro patients that have a lot of joint pain, need to just stay away from it. The only thing I would use, the exceptions, are xylitol and stevia. They're the only two that I've seen that haven't really caused any problems. So understand, inflammation's like having a fire inside of you. Your job is to stop throwing gasoline on that fire. Stop eating foods you're sensitive to. The other thing you can do is actually put the fire out by using some high-quality nutraceuticals that are designed to put inflammation down. You can find a list of those on my website. Just look in the description below. Thanks for checking out my story, and before you go, please remember, if you like this and you found it useful, give it a thumbs up and share it. The other thing is, don't forget to subscribe. Just click this right here. That's the subscribe button, and you can find lots of other stories like this on my page. Lastly, if you want to ask me questions, you can find me on Google+ and connect with me there, and go ahead and ask me directly. Since you have fibromyalgia, it's very common to also have thyroid issues with it. Check out my